Welcome to Catch Her Spark with Jen Maldonado. These are conversations with women who are building meaningful careers, stepping into leadership, and designing life on their own.
Hi, everyone. Whoa, whoa, whoa. I have to introduce you to Dr. Ruby Rose, right? Before Dr. Ruby Rose ever helped a single patient find their why, she was a patient sitting in front of doctors who kept telling her everything was normal while she knew something was wrong. So that's Dr. Ruby. That frustration is the reason her entire practice exists. So she went beyond traditional medicine. She started in the emergency medicine, the kind of medicine built on a speed, not the root cause of the problem. So then a serious car accident changed everything for her. And in the aftermath, she went looking for answers and kept hearing the same thing from doctor after doctor. She went looking for those answers, but knew her body and she knew something wasn't right. So she was listening to her body. And that gap between what the test said and what she actually felt is what sent her looking for a different kind of medicine altogether. And so far, she refused to stop there where every doctor told her that. And she went on to study under one of the founding voices of integrative medicine. And later, she trained under the Institute of Functional Medicine, learning to treat the whole person instead of just the symptom in front of her. So in other words, she built her whole career around a promise to her patients. You're not crazy and you're not just normal laughs, because she knows exactly what it feels like to be told that and not believe it. So this is her journey. Let's welcome Dr. Rose. Dr. Rose, how are you today?
Oh, thank you for that lovely introduction. Gosh, I couldn't have done it better myself, really. Thank you. And
Well,
yeah, for
yeah,
the podcast and inviting me on.
I'm excited. I'm excited. I mean, I love when women step in and she say, I just don't want to stop in the traditional way. I want to go beyond because I really have the commitment to help people. And if I went through this journey, right, there has to be many other people dealing with this. So I want them to feel cared for. So tell us, Dr. Ruby, tell me, was that something, what happened on that accident that changed your life and lead you in a different path?
Yeah. Well, it started even before that, but that accident really shifted my traditional way of thinking about medicine to switching to something where, wow, there's something else out there that can help me. So I'm going to back up to my upbringing where, I kind of started off in a very non-traditional way. I didn't think I was going to go into medical school. I didn't think I was going to be a physician. And so I was born in Paris, France, to an American mom. She's from California. And my father was from Germany. So they met in Paris. He was a fashion photographer, and my mom was a fashion model. And she was actually the first Black model to show her whole face on the cover of Vogue in 1972. So that's her claim to fame. Carol Labrie is her name. She's an amazing, she modeled in the 70s. And so I was born in Paris, came to New York City, was brought up in New York City. And so I started off actually in the fashion industry. I was a model at 14. I modeled for 14 years, actually, all through college, medical school. And so even how I met my husband was on a modeling gig. So, and, that whole process, I knew I didn't want to go into fashion. It was, so I decided to go to college. I was the first one in my family to go to college. I was always interested in biology. I was very curious. And this is where, like, I feel like this is how I got to where I am now, is because I always had this curiosity, right? I wanted to always learn more and more and more. And so when I was in college, I was kind of lost because I was pre-vet. I wanted to go into vet school. I loved animals. And I was just like, it's missing something. I want to know more. So I became an EMT, just like it was a random class I took in my senior year. And I loved it. I ended up loving it. I love talking to patients. I love learning about the human body more. And so I took 2 years off to go to apply to med school. And then I went to med school. I went to Tufts. And moved to Boston, and gosh, I mean the whole stress of medical school. You go through 4 years, and then I did my my residency. So I chose emergency medicine because of the EMT experience, and I wanted to be like jack of all trades and know what to do in every situation. But the training was pretty grueling. I was in the teaching hospital for 3 years, and then I was pregnant in my last year. I was a chief resident, and I was pregnant with my first child. I have 3 kids, and I went to another job, and I started feeling that feeling of like burnout, and people talk about burnout a lot, and you're like, yeah, burnout, you're just tired, and all the things, but I went through 3 years of working at this other level 2 trauma center. I worked in the pediatric department and the adult. Saw a lot of, like you're seeing death all the time, right? I mean, it gets to you after a while, pediatric deaths too. And I was like, wow, it was really affecting me at my soul. And so we ended up moving to Austin, Texas, and I started working for the big hospital system here. And I realized that after another 3 years, I was feeling that kind of burnout again, but to the point where my body was sick. Like I knew there was something wrong. I was having panic attacks. I was kind of like not depressed, but just not myself. My gut was a mess. I was getting arthritis. I had daily headaches, like daily migraines. I was total mess. And then I had that car accident. And that car accident was pretty bad. I had my kids. My kids were little. One was in the car seat. They were actually both in car seats, and my son was like covered in gasoline. We were just hit by like, a car trailering like a big skid loader, and it rolled off the skid loader, whacked our Suburban. Like I was in a Suburban, and every airbag went off. I mean, it was like a big hit, but it saved our lives. I mean, if I was in any smaller vehicle, we were in Texas, right? Any smaller vehicle, I probably would have died. But so the next day I was like, oh, I'm going to feel like crap. There's no way I'm going to be able to not move. My neck's going to be sore. And my neighbor at the time, his name is Mark Hernandez. He's amazing. He's a physical therapist and just brilliant. And he's like, come over, let me dry needle you. And it was the day of the accident, actually. And he dry needled me. And the next day I woke up and I was like, wow, I don't even feel any pain. Like I felt amazing. I'm like, what did you just do? Like, what? How did you do this? I see patients all the time in the ER who are like, they can't move. They're just like this. And I was like, what is this? Like voodoo stuff, right? And and at the same time, because I was feeling so bad, I had been looking into the integrative medicine fellowship program. And so I quickly recovered from that accident. I immediately like applied for this fellowship. And over the next 2 years, I got out of my burnout. I started loving medicine again. I was going to quit. I was going to completely quit medicine. And I just approached patients with just love and acceptance. Like before, like a patient would come in, I'd be like, why are you here? What do you need? Like, oh, I'm so annoyed. I would roll my eyes all the time. I'd say things like, it was just like, it wasn't me. It wasn't why I went in medicine. Right. So yeah, so that's kind of what happened with the car accident. It kind of just like bolted me out of this, like, okay, I got to make a change. And there is something beyond what I was being told. I went to GI docs for my gut issues, and I was like, not once did they talk to me about my diet. Not once did they talk to me about food allergens. Not once did they talk about inflammation. I got a colonoscopy, everything's clear, you're good to go. Okay, well, why do I feel like crap? I get this all the time in the emergency room. I do these big workups, and patients are like, well, why do I still feel bad? And I'm like, because the ER workup is not everything. Your CT won't show everything. Your labs won't show everything. We got to have a much broader perspective of health. And so that's how I got into integrative medicine. And I don't want to keep talking here, but I can keep going.
No, I'm gonna start asking now. That's great. I mean, so you have this accident. You were already curious about different ways of approaching things. You start losing your passion, and pretty much this accident reignite your passion about health through a different path. And when you saw what this other person and how this other person helped you on that day, you say, there's something else. What is that I'm missing? Right? And you went into this journey. Let's go into this journey and learn new things about medicine. And that's when you discover your joy and your meaning beyond your work. I love it. I love it.
Just tell patients, like, never stop asking questions. Even when patients come to me in the emergency room, they're like, "Oh, sorry to ask." I'm like, "No, keep asking me questions because you need to understand your health. You need to understand your body. You
Yeah.
need to understand why you are here today with these symptoms, right?" So that's like what I took away from that experience. Like, I needed to understand more about what my body was doing, right? Um,
Yeah.
so during COVID, COVID was awful for everybody, but I had to go to work. Not the
Yes.
same, right? I had to figure out how to protect myself and my family. Um, and that's when I really started thinking about, okay, how am I going to protect my immune system? I had gone through I went through like a virus. It was before COVID, and the virus had sort of attacked my brachial plexus. So I lost some function to my arm, which came back with, rehab and stuff like that. But I started thinking about, wow, my immune system is like pretty compromised. So during COVID, I was like, oh, I'm getting my immune system up and going, right? And so part of my integrative medicine training was about, mind body connection, learning how to calm your system, learning how to connect with your nervous system, connect with your gut, how to eat better, how to sleep, doing all those pillars of medicine that are pillars of life that are so important: sleep, stress reduction, good food, reduce toxins, connection, all of those things, right? So, but I went through COVID, and during COVID, so I married a producer. He's a retired television producer, but he's doing other things. And we developed a TV show that we filmed out of our emergency room called "This Came Out of Me." It was on Discovery Channel.
Uh-huh.
During the filming of the show, keep in mind this is during Delta, like COVID. It was bad. We were full on masked, and we're filming this TV show, right? My stress was like, and so I ended up going through menopause pretty early. It just threw me in menopause. And so I, again, was at a point where I'm like, I don't feel like myself. I'm not sleeping. I had complete insomnia. My joints started hurting. Headaches started coming back. And I'm like, I know something's wrong. I went to my gynecologist. They're like, you're too young to do labs. You're not in menopause. I'm like, and because I had an IUD, I wasn't having my periods, right? And I was, no, there's something wrong. And so I found another GYN. But before that, I was like, okay, I need to understand this myself. So I started taking functional medicine courses. I entered the Institute of Functional Medicine certification course and ended up getting my certification in that, but did my own testing, of course, and found that I was like completely in menopause. I was like post-menopause. And so I brought my results to my gynecologist. She's like, "Oh yeah, we'll start you on hormones." I'm like, "Hallelujah!" I was sleeping. I was happy. I was like doing my thing, right? I was back to it. But then I was like, "Dang, like, why is it so hard to feel like when you feel like crap and you bring this up to your doctor? Why can't they address that?" And it's not everybody. I don't blame primary care doctors, or even most OBGYNs. I don't. The system is broken. It is not set up to deal with things outside of the norm, right? They do their tests, everything's normal. Okay, you're good to go. If there's anything else, you're like, oh, sorry, I can't help you with that. They don't have time to dig deep, right? So that's why when I was in the emergency room and I was having these people come to me with these symptoms and I would come up with everything's normal, I was like, gosh, I need to go a little bit step further. I need to give these people an opportunity to, because a lot of them would be like, well, why can't I just come see you? I'm like, well, I don't have my practice. And I would say that for like a year. I'm like, you know what? I'm gonna start my own practice. So I started my own practice in 2023. And it was initially virtual, and then I went in person, and now I'm doing integrative and functional medicine. And for both men and women, I mostly focus on gut health and hormones, reducing toxins, getting energy back, like all the things, pretty general. And I'm loving it. I'm really getting those patients who have been told there's nothing wrong with you, or they've been told or gaslit this, saying you're fine. And then people are like, no, I'm not fine. I know I'm not, because I know I've been there. I'm like, I'm not fine. So yeah, that's how I got to my functional medicine.
Wow.
Yeah.
That's amazing. I mean, you pretty much have rebuild yourself multiple times after different factors and trust yourself on the changes you wanted to make. I love that fact. I think a lot of people second guess themselves on the process. It's like they're the doctor, maybe they're right, maybe it's just me, and they give up on the idea of feeling better, and they don't get curious.
Yeah, they forget what it is to feel normal. I had a patient tell me the other day, I didn't realize I'm not supposed to be in pain when I have a bowel movement. I'm like, yeah, no, you're not supposed to be in pain when you have a bowel movement. You're supposed to feel great when you have a bowel movement. You're like, yes. Being sad because people just forget what it feels like to feel normal, right? They don't know what that normal is. One of the questions I ask is, when was the last time you felt normal? And it takes them aback because they're like, gosh, I don't remember feeling normal. Well, actually, well, maybe it was here, maybe it was then. And then we start building that sort of timeline where you're like, oh, okay, well, I started feeling bad here. Okay, well, what happened there? What was your life like at that interface, that got you to the point where you started feeling bad? And let's
Yeah.
backtrack. We're kind of like little private investigators in medicine, right?
Love it. Critical thinking and the research intelligence. I love it. I think it's pretty interesting because I remember when I changed primary doctors, every time a doctor wanted to give me a kind of a pharma without even asking me about my diet, my lifestyle, I'm like, I'm out. It is so disappointing. And then I found this guy and I go to the doctor and he started asking me, okay. And I'm like, let's see what he has to say. Let's talk about your lifestyle. How much you exercise? Do you drink water? And this and that. And I'm like,
What?
are you sure you're a traditional doctor? And then, okay, yeah. And talk to me about your diet. How much protein do you consume every day? And I'm like,
Yes.
I found one of the great ones. What a
Yeah.
blessing. Yeah,
And thankfully nowadays people are getting that information now, right? It's out there. Thank goodness for, what social media is like touch, I don't know. There's good information, there's bad, it's at least bringing the issue to the forefront where people can start asking those questions
correct.
and then think about, does this intuitively make sense, right? Like have some common sense about some of the things you listen on social media. So just be careful about that. But and then, yeah, but you're right. I mean, I was never taught nutrition. I mean, or at least my nutrition course was like minimal. It wasn't nothing in residency when it came to lifestyle. I mean, I was training back in the days when we had, you know, 36-hour shifts. I mean, it wasn't the lifestyle was like, no, you just got to suck it up and move on. So it's changed a lot.
Yeah.
It's changed a lot.
Yeah, I can imagine. And, it's to your point, social media has a lot of information. I always tell people just look at this information and take it to ask the right questions, not to take it at what they're saying, but ask right question and talk to your doctor. Um, Make sure that they go beyond treating the
Yeah.
symptom.
Yeah.
Let's find those root causes, and that's what I love about integrative medicine. I mean, my mom and my brother comes from the medical industry too. He's a doctor too, and he's passionate about this. And I understood early on the importance of the whole hurt. Health, right? So in your case, you have experienced the things that were broken in the system. You start shifting, you start transitioning, finding your passion. You have a car accident that changed your life. You start making changes, but also there's other things happening in your life that have opened to different perspectives. Can you share a little bit more about Ruby Rose and the things beyond Dr. Ruby, right? What else is happening in your life that have shifted so much for you?
So back in the fall, I started my in-person clinic, and I'm doing my thing. And then I went in for a screening mammogram, and it came back abnormal. My previous ones had been normal. Well, I wouldn't say normal. They were just dense tissue. We get that a lot as we get older. And so fast forward, it was abnormal. I was diagnosed with breast cancer. And so I was like, okay, this was like out of left field. I'm like, how can a functional and integrated medicine physician get breast cancer? I was like, no, this doesn't happen. Like, I was just almost in denial. And I was like, well, what did I do wrong? And it was like a lot of self-doubt and like, am I recommending the right things for my patient? And I went through this spiral of just disbelief, anger, self-doubt. And then something just dawned on me that I was like, you know what? It's not my fault. 1 in 8 women get breast cancer. And majority of those women are not, genetically predisposition. They don't have the BRCA1 and 2 genes. They don't, have any genetic precursors. Only like 10% of women actually do. So I'm just one of those unfortunate cases that I did get breast cancer. And who knows if it was from some epigenetic exposure there where I maybe I was exposed to something in, when I was younger. I don't know. But what I did realize is that I got to the point where my health was good. I decided that I was going to go through with a double mastectomy. I had it in January, and I had reconstructive breast surgery at the same time, so I didn't have to have two surgeries. Um, I had a little bit of a couple of complications after the surgery, but I went back to work after 3 weeks. And granted, that was a little early. I do not recommend that. But, I would say the biggest thing that I didn't realize I would really like would affect me the most is just the fatigue. I remember going back to work and just wanting to lay on the floor and just like take a quick nap. Like I was just so tired. And that quickly, by like 6 weeks, I was pretty much back. And then you're just getting used to your new body. But I realized I had prepared myself to recover. I had prepared myself to probably not get such an invasive, really, I didn't have any invasive disease. So I was a healthy candidate for everything I was going to be doing with breast cancer. And I attributed that to my lifestyle and learning, about my integrative and functional medicine, tips to sort of help me with my immune system and my nervous system and so on and so on. So I got through the surgery pretty well. And I was able to then connect with my patients on a much different level. Like it just gave me another understanding of like, wow, breast cancer is so individual. It is so individual. Every patient has a different type of cancer, and they're dealing with different, obstacles and challenges and, personal conflicts that they're having, right? And it allowed me to just be present for those patients, and accept and to listen and to maybe even work through some of the problems that they're having, right? I had to stop my hormone therapy during that entire thing and experience. And it was, it threw me back into menopause. It was not fun. But it didn't stop me from recommending hormone replacement therapy. It does, as we know, estrogen doesn't cause breast cancer, right? So it was definitely an eye-opening experience. I have learned from it. I'm glad I'm on the back end, and now I'm hopefully helping others kind of get through their diagnoses and you know.
Love the story. I want to dig into this because there's many people dealing with. So you just open the area. I mean, I love how you have shift based on the life experiences too and follow your intuition, your desire to help people as a healthcare provider, right? And now that you have dealt with these things, you point out very critical factors, mind or mental health, right? Body health, right? And understanding how your body function. Let's start with the health and the mind health or the mental health. So you mentioned a couple of things that you were in denial, you were angry. How do you navigate that emotional journey in order to put yourself in a position ready to accept a plan to heal yourself?
Well, number one, stop blaming yourself. This is particularly in women, we blame ourselves, right? We are the first ones to be the biggest critic of
Yeah.
ourselves.
Yes.
And my husband helped me so much through all of this. He was so supportive. And and just reminding me, this is not your fault. You're not doing anything wrong. Um, so that was number one. The other thing was acceptance. Okay, I've been given this card, right? How do I play this card now? How do I learn from this? Everything that I have gone through in my life, I take it as either a sign or a mission, right? What am I going to do with this information? How am I going to help other people? Um, so then I took it as that. My husband, we started filming my recovery. We filmed the I guess the day or the weeks leading up to, like, all of my, I had to have MRI, I had to have all these other imaging done. I had to have the biopsy, and so we kind of filmed it, and we have it, like, in a vault, and maybe someday we'll do I don't know, a TV show about, a physician with breast cancer. I mean, there's many of us out there, of course, but,
Yeah.
um, and I think that helped distract me and gave me kind of a mission, like, I'm going to help other people. And so I think that's what kind of changed my mental health about this. And I kept educating and getting educated myself, and then helping my patients get educated, and that helped me. And my patients helped me too. I mean, some of my patients are breast cancer survivors, and they're amazing. I mean, their fortitude and their vision and they're just brave and strong women, and it's just amazing to be around people like that. You know.
I love it. I love it. I love how you have taken this struggle and you turn it outside of yourself. And I think a lot of people, when they're going through a very big challenge in life, no matter if it's mental, physically, or everything, when they take out themselves out of themselves, they find ways to pivot, to pay it back, to not make it about themselves, but the other people. And suddenly that becomes a healing factor.
Yeah, yeah,
And I love how you shifted that, right? So you have been caring for people for so long. Now you have to be careful. And those people, those patients, strong women, and that's what I love about hanging out with women. They lend you their courage to continue to this journey. So yeah.
the same thing happened when I went through my third burnout before I went and did my integrative medicine fellowship. So when I joined the fellowship, you have these experiential sessions where you're there for a week, and we start as a class, and we get to know this class over the course of 2 years, and you connect with people at such a deep level, right? It's part of the training is like that learning the connection, connecting with the patient, learning about their story and their timeline, but it's also connecting with others and letting others heal you as well. And so that I learned that connection through that. And it just really, like, I think that's one of the things that really made me love medicine again, is because, that face-to-face connection, that human connection. When I walk into the room in the emergency room, I literally touch the patient. I hold their hand. That connection right there makes them feel like, oh, it brings you down. It's this energy connection that you have between another human being that is it's a raw energy that people feel, right? It's an intuitive energy. When somebody walks in a room and they're all mad, and it brings you
Yeah.
down, that's what I'm talking about, right? I mean,
Yeah.
human beings can feel this with other human beings, and I think that's kind of, I don't know, I bring that with me everywhere now.
Yeah, it's so important too, and that's being present and bringing that energy to the room. I have seen this tagline. I don't know who say it, but be aware of the energy you bring to the room. It's always been so that helps me always to remember that, especially when I go through a moment of anger, which it doesn't happen often, but when it happens, you can see it. So I'm Puerto Rican, the Latina things come and it's like, so it's hard for me to calm myself down. But to your point, that little thing on my mind, always be aware of the energy you bring to the room. It always helped me because I know also those interactions help healing. People don't realize how much. So you go through this mental stage where you start healing and opening yourself to welcome the healing too. So how do you prepare physically? What are some of the things you do, right? We don't want anybody to have cancer, but it's a reality, as you say. What do you do physically, emotionally to keep yourself healthy, your body healthy for something like this?
Great question. Yeah, because it's not just cancer that can get you. It could be a car accident. It could be, a different diagnosis. It could be a diagnosis for someone else that's making you stressed out, right? It could be you could lose a job. You could have a baby. I mean, it could be so many things. So, um, for me, it's what keeps my body healthy is moving. So I'm kind of a busybody anyway, but like I think exercise is really if you're going to make one improvement of your health, exercise hits all the points, right? You check all the boxes in terms of mortality improvement, disease reduction across the board, and then keeping your muscles fit, your bone, your brain. I mean, it hits all the boxes, right? So exercise is something that is a non-negotiable for me. I try to work out 3 to 4 times a week. If I can do more, I do. I do different types of exercise, anything from weight training. I'm doing more weight training now that I'm in postmenopause. I used to do cardio, and I wasn't an athlete when I was younger. I did equestrian sports. I'm a big horse freak, but I did equestrian sports. But I played basketball, volleyball, so I was active, but I was never like in college and med school. I mean, I rode my mountain bike to classes and stuff, but I was never really an athlete. But when I got into like after I had my kids, I started, going on jogs and running, and I started loving that exercise high. And once you start doing it on a regular basis, you start to really crave it. And then I realized exercise really helped my mental health. So my husband's always like, "Do you need to go work out? I need to go and do your workout." I'm like, yeah, I gotta go do my workout. So that one is huge. The other thing, and I talk to my patients about this all the time, is eating a clean diet. So, the world is constantly trying to kill us. Food is constantly trying to kill us. Like, particularly in the United States, our food options are not great, right? Too much processed food, too many toxins in our food supply. There's food deserts everywhere, and people want the quick, easy to go, right? So what I try and do is it's all about meal prep. I prep my lunch. I try and have mostly protein and and fiber and vegetables. I try and avoid gluten. That's really what my issue was that brought my inflammatory levels really high. So when I
Okay.
avoid gluten, I mean, once I got rid of it, I got those daily headaches went away, my arthritis went away, all my allergies went away, my gut, 90% of my gut symptoms went away. My skin cleared up. I mean, it really like improved my health significantly. And that's for me. I don't tell everybody to go gluten free, but I do tell everyone eat clean and maybe pay attention to the things where your body sends you signals. People don't realize, people ignore those signals. And it's my job to remind people like, hey, this is your body telling you it doesn't like something, right? So so you just have to listen to what those signals are. And if your signal is every time I eat this, I feel this way, whether it's fatigue or headache or my stomach hurts or whatever, listen to it. Like, and then get that out of your system, right? So food is the second thing. And then sleep would be, I struggled with sleep. And once I got back on my hormones, sleep was better. But sleep, you have to prepare for sleep the minute you wake up. You have to manage your nervous system throughout the day so that you're prepared, your cortisol is prepared to be nice and low when you're trying to go to sleep, and it stays low while you're asleep. So I would say those three things are things that I really focus on the most to keep myself healthy. Because you don't need all these supplements if you're eating right and you're getting rid of the toxins and you're moving and you're detoxing, you're pooping, you're peeing, you're sweating, you're doing all those things, right? So some people need supplements, of course. I mean,
Yeah.
you're
It's
supposed to
so
follow a
individual.
normal diet. Yeah, exactly.
Yeah, so individual. One of the things that I'm always keeping attention when people say you should do this or you should do peptides, and it's like, um, It depends. I'm not a doctor, but I know that every individual have a different system with different behaviors inside of the system. So everyone needs to understand what happened in their system before they go crazy and they hide.
Yeah.
Um,
Understand your body.
yes,
Yeah.
correct. So I love that. Listen to your body.
Yeah. 100%. So many people, and actually particularly so many women do not know their bodies. Um,
Yes.
so when I'm in the ER and I have young women come in, um, I love to teach them about their bodies, especially when it's like their first pelvic exam. You know, you have to go to the ER and you have to get your first pelvic exam. That's no fun. But I teach them about their bodies. Hey, this is what your cervix feels like. It's like the tip of your nose. Or like we go through it, what it looks like. Like, have you ever seen your labia? Do you even know what your labia is? You know, like
Yes.
all the things. Like learn about your body. You know, be curious about it. You know,
I
so
love that. I love that. Learn about your body, listen to your body. And yes, that's I think that should be a rule.
we teach our kids. You know, like what's your
Yes.
body telling you right now? How do you feel? You know.
Yes, I love that. I love that. Now, we're getting to the end. I'm like, oh, I would ask you so many questions. But if you were going to talk to women out there, right, that they're trying to regulate their nervous system, what is one step or something that you will advise to say, hey, get your nervous system in check because that also impact your body and your mind.
Yeah, 100%. Yeah, you know, cortisol is a big buzzword right now, but you know, cortisol is important. Like it's an important hormone. And what I tell women who are focused on, you know, I feel like my cortisol is really high and I'm stressed out and I'm all this and all that. Women, they have the tendency to treat themselves the last.
Mhm.
And as we go through perimenopause and menopause, I start telling them like, hey, you need to be number one right now. Like you've had these kids, and even for women that haven't had kids, like think about like you first. Like you are the priority, right? And start listening to your body and what it needs. And then to help your nervous system, like you know I talk about breathing exercises that they can do, taking a pause. You don't have to sit in a meditative position with your legs crossed to calm your nervous system down. You can do this by rhythmic walking. You can do this in your car with rhythmic breathing. You can you know, you can call up a friend and laugh. That, you know, at that alone, like just laughing with others is reduces that nervous system. Taking a bath, like just taking a moment for yourself. We just don't do that enough, right? We don't take the time. I just tell me, I come home from work. I'm like, you know what? I need 5 minutes. Don't talk. Don't come in like, I need 5 minutes. I'm going to check myself and be a better person afterwards. So people need a break, right? And
Yeah.
you just have to, like, you have to recognize that. So that's what I would say. Like to get your nervous system down, you just got to take time to treat yourself, like baby yourself, you know?
I love that. I love that. Well, Dr. Ruby, if people want to get hold of you, what's the best way to connect?
Yes. So I would say I'm mostly on Instagram. So I'm Ruby Rose underscore MD at Instagram. I'm also on LinkedIn. And I don't do much on Facebook anymore, but my practice is at Breast and Body Center of Austin. I also have a website, drrubyrose.com, although I'm revamping it a little bit right now. So, but you can find me on there as well. So, yeah.
Well, thank you so much for being with us today. It was such a pleasure. And I mean, so looking forward to your new curiosities and adventures.
Stay curious, everyone. Thank you for having me and for what you do on this podcast. Appreciate it.
Thank you.
You've been listening to Catch Her Spark with Jen Maldonado, where bold women lead the way. Ready to share your spark? Apply to be a guest at catchherspark.com/guest.